Hello, everyone. I'm Dr. Diana Bitner, Chief Medical Officer and Provider at True Women's Health. I'm so excited to invite you tonight to our tonight's episode of Let's Chat. We're going to talk about Let's Chat about bringing happiness back into the bedroom. If there's little ears around, you might want to put in earphones. We'll be very classy and appropriate, but yet talking about subject matter you might not want your 11-year-old to hear. But again, we're looking to make the conversation around this more comfortable. A couple of housekeeping items. Tomorrow night, I'll be hosting Facebook Live with CKO Boxing, owned by Shelby here in Grand Rapids, Michigan. So very excited to talk about what choices today can, how it can change our tomorrow. And next Wednesday night, our Let's Chat will feature a very special guest, dear friend of mine, the most world famous menopause expert, Dr. Jim Simon. So I'm so very proud that Dr. Simon will join me next week to talk about HRT. It's safer than you think. So please tune in next week and send us your questions in advance. So tonight, again, we're going to talk about bringing happiness back into the bedroom. Please put your questions in the chat bar, and we'll make sure to look at those and check those as we go. Also, if you want to do a question in private, it's okay to personal message our Facebook page, and our team will let me know those questions so we can answer them during or certainly afterwards. So tonight, let's get back to tonight. I am so honored to welcome my dear friend, Becky Lynn, Dr. Becky Lynn from St. Louis. She is also an OBGYN, just like me. And like me, she got very interested in midlife and menopause and sexual health. So Becky is here tonight with us. So please welcome, again, my dear friend, Becky. She has started her own practice. She is the founder of Evora Center for Menopause and Sexual Health. Becky, did I get the name right? I'm sorry.
You did. Yep, you nailed it.
Okay, good. And so we're here tonight to talk about how to bring happiness back in the bedroom. Dr. Lynn is also a certified sexual counselor by ASECT, and I'm very happy she can bring her expertise here as well. She has her own private practice and also provides telehealth, and we're just so happy to work together to bring this accurate information to you all. So again, thank you for inviting us into your living rooms and your offices, and we're here to talk tonight. Becky, please.
Sure. Thank you so much for having me. This is really fun and really exciting. And it's definitely my mission to empower women to lead healthy sex lives. I really believe that our culture kind of keeps sex hush-hush. You shouldn't enjoy it. You shouldn't like it. And if something's not working right, don't ask anybody about it. But it's really important that it's part of health, right? It's like food, shelter, and sex. So it's really important that we talk about this and let women know that there is help and that they're not alone.
Exactly. And I even love how the World Health Organization has a definition about sexual health. And it's not just about safe sex and avoiding sexually transmitted disease, but it's about that women it's okay to have sexual health in a safe manner without coercion, by choice, all of that stuff that we've been, it's so important to talk about it. And I think tonight is such an appropriate title, bringing happiness back into the bedroom, not only as a creative way to be able to talk about this on Facebook and other channels, but it's also really, like, in the end, right, what people want, like to have sexual health, to have a sexual relationship without stress, without all the stuff that gets put on it, the guilt, the shame, the feeling isolated, feeling alone, right? So how can we make it easy and about intimacy and pleasure?
That is the million-dollar question, right? Because sexuality is so complex. And I feel like a lot of times women just think, I just need some testosterone, it'll fix everything. But it doesn't work that way. There are so many things that play into how you feel in the bedroom. It can be your hormones, it can be chronic illness, it can be a relationship issue. And even in the best of relationships, sometimes there's communication problems. But the thing is that when people have problems in the bedroom, it seems like a small thing, but there's a multiplier effect. It starts to cause problems in the relationship, then that spills out over into the family. Some partners end up separating. So it's definitely something that we want to manage and take care of. And the way we treat it doesn't mean you just need medicines. You know, there are a lot of things you can do that aren't medicines. Just little things like touch your partner 6 times a day. When you touch somebody, that's my little thing. I touch my husband 6 times a day, right on the belly, over and over again. Not that I'm recommending that you do that, but just that human touch helps you. It makes your body release oxytocin, which is the bonding hormone. So just human touch brings you a little bit more intimacy. So I think that's really important. Little things like that, spend time with each other, nurture your relationship. Don't let your spouse become your last priority, or your partner. You have to, even though you've got a job and kids or whatever you're doing, you have to make sure that you really work on that relationship too.
Exactly. And so tonight we're going to talk about an example that both Becky and I have seen patients similar to the story we're going to share. And then we're going to talk about why people have low sexual desire or sexual dysfunction, what kind of professionals can help. And then we're going to leave you with 5 tips that you can take away that you can even think about tonight. Also, what we talk about tonight will be a blog that will be on both of our websites. So if you also want to read more or take time to, listen tonight without taking notes, but you can go back to that blog that will be up in a couple days to actually have these things lined out. And so when I was thinking about tonight, sexual dysfunction affects everyone, right? It can affect a 27-year-old who has pelvic pain. It can affect a 20-year-old who had a history of date rape. It can affect a 80-year-old who hasn't had sex in 20 years. So there's lots of reasons. But a patient that came to mind was a patient named Andrea, and it's not her real name, of course. Andrea was came to see me for her annual exam. She'd been married to Dan, for not his real name, for 20 years. They had 3 kids. They both worked full time. They both were busy juggling extended family. They both, wanted to spend time at home, but still have friends, and they were busy at church. So they had lots going on, but they really had a good thing. They cared about each other a lot. They felt close, and they developed a schedule that just worked for both of them. It didn't feel over-planned. It just was Saturday morning they would be intimate. Wednesday night when the kids would go to youth group, they would find their time. And that really was a good thing that they both looked forward to. And it worked. And whether or not it was a quickie or something that lasted a little longer, they both knew when it was going to happen. They both had expectations, and it really worked for them. But then what happened is then, over time, they both got busier. Andrea wanted to sleep in on Saturday mornings because it was her only time, because church was early on Sunday, and Dan would have to work weekends. And then Wednesday night, they were too busy catching up. So it became, okay, next week, okay, next week, okay, next month. And then when she came to see me, it was like, wasn't happening. And then, what can happen when you kind of don't want it? Like her husband would sort of suggest it, and she'd be like, that's the last thing on my mind.
Right.
Maybe she would do it anyways, right? And then it would hurt because she wasn't ready. And so then pain made her not want to do it.
And he probably felt rejected. So men or your partners, you ask for it, the partner says no, you ask for it again. Eventually you're going to stop asking because you feel rejected.
He did. He felt like she must not love me anymore. I must not be important enough to her anymore. And she's like, what are you thinking? Of course I love you, dude. I just took care of everybody else, made dinner for everybody. I haven't had time to work out. I have not had 2 seconds for me. It has nothing to do with my feelings for you. So it just became this uncomfortable thing.
And that's such a common story.
It is such a common story. And so, just like Dr. Lynn and I, we sit at these meetings, right? We have these incredible lectures like by Dr. Simon, Dr. Kingsburg, about all the reasons for low sex drive. And I remember sitting in one of these meetings and going, how can I remember to bring all this stuff back to my patients?
Right.
So I invented the sex deck. And Becky, if you want to use these in your office, we can do that. But it's a sex deck, and it's the 27 reasons for low sex drive. And so I thought, if I can have this tool to help this, get the conversation going with patients, maybe this will make it easier. And on the front of the card is a reason for low sex drive. And on the back is why it's happening and what one can do about it, right? And so it was really fun. So I had Andrea in the office, and I said, these are the 27 reasons for low sex drive. I want you to see that you're not crazy. So I want you to go through the deck of cards. They're divided into physical, psychological, and interpersonal, and pick out the cards that might apply to you. So she picked out physical inactivity. You can put there. She had no time to exercise, and she wasn't getting any exercise. Plus, she had gained weight, affected her self-image, and she didn't even want to get naked in front of Dan anymore. Like I'm not feeling it.
Right.
She picked distraction. So she was distracted with all of her list of things to do. Dan's mom had fallen, and so she had to make sure she was cooking for her mother-in-law and checking on her. So she was very distracted. So while she was maybe wanting to be sexually active, she was also thinking about, painful sex, because she was maybe having sex when she didn't want to. There was dryness.
Aroused.
Her body was like, what?
Yeah.
Right? Okay. She picked vaginal dryness, which happened from her lack of arousal, from her lack of desire. She picked fatigue. She didn't have anything left in the tank.
Right.
Engaged, right? Job stress. She was so busy. Like, how can she get it all done? So job stress was an issue. Poor self-image, because she felt fat and out of shape, and she wasn't feeling very sexy. History of pain. It hurt the 4 times before, so why do I want to do something that hurts me?
Every woman that walks through my door, pretty much. I mean, like, it's just this Andrea is just so common. That's exactly what we hear.
So common. We have to talk about this. Insufficient intimacy. She felt like her and Dan were missing each other, like they weren't on the same page. She felt like he's not even helping, but yet poor Dan was stressed and tired because work was stressful because they had to lay off some guys and all of that. Poor communication. At this point, they are totally silent about sex. They're not talking about it. They're mad at each other. And then, what's this one? Unresolved conflicts. So it's all about all these conflicts that are under the surface. Again, what is sex? It's intimacy and it's vulnerability. I mean, when are you more vulnerable than when?
Right. And, you're kind of talking about this, woman who's got a good relationship. But throw into that some real conflicts.
Yeah.
Some real conflicts in that relationship. And that's, that just adds insult to injury.
Or how many patients have like a mixed family where his kids and my kids and your kid will get off the couch and your kid is moving macaroni and cheese around and like your parenting sucks. And so there's and then even I had a patient who, with emotional abuse, like she didn't want to be vulnerable with this guy who was treating her poorly, right?
Right.
So Andrea saw these cards and she just cried. She was like, oh my God, I'm so relieved that I'm not crazy.
Right.
B, there's hope. She said, you have given me hope. And she was so excited to bring the cards home to Dan because like so many men, not to stereotype, but like to figure out why, right? And fix it. And so she could give them reasons so they could start to resolve it. So I'm sure, Becky, just like you, like we walked through each card and we made a plan. So she left the office with a plan and it didn't take forever. It was like very efficient.
Right. I love that sex deck idea because it just sort of outlines everything. Usually in my office, I have a template. So I just walk through all of the things that might contribute to sexual problems in a couple. And then I address each one. Because if you only address one thing, they're not going to get better. So it's really, that's one thing that I think is important for women is that if you have somebody by you in your city who's a sexual medicine specialist, it's really important that you seek them out because they'll go through all those other issues as opposed to, it must just be your hormones or,
Or go on a date, right?
Yeah, or go on a date or drink wine. I can't tell you how many women I see with true sexual problems have been told to just drink wine or have been told to just put up with it.
Yeah.
You have to do that. That's just, put up with sex when you don't want it. And that's never the answer.
I know, but what makes me so sad is that we know that 80% of women in their lifetime have a question about sexual health, but only 20% of docs are comfortable talking about it, or nurse practitioners, or certified nurse midwives, or PAs, because we don't get training in this. And so, if we don't feel like we can fix it or we know what to do, it's the last thing we want people to bring up, right? So we like to avoid it.
Don't ask. And, if you're looking for somebody who's a sexual medicine expert, you can go to the ISWISH website. ISSWISH stands for the International Society for the Study of Women's Sexual Health. It's a fantastic resource, a fantastic organization, and you can just, plug in your state or your city and find a professional near you.
Exactly. And to a lot of providers, if you go to menopause.org, you can find a certified menopause practitioner. So not every certified menopause practitioner maybe is a specialist in sexual health, but they've had good training and they would know people in the area who know more than they might know. And so even in your area, you could find a certified menopause practitioner, and that can be really helpful. But, it's been great to get this training and then be able to bring it. So for example, a patient, 44-year-old with breast cancer, instant menopause, low testosterone, low estrogen, maybe now she's on an estrogen blocker. So there's lots of things involved. So number one, with local vaginal estrogen or with the Mona Lisa touch, we can help her not have skin issues. But right, Becky, there's pelvic pain issues from tight pelvic floor muscles. And so then we all work with pelvic floor physical therapists.
Right. So, especially breast cancer, those, patients get thrown into menopause. So when they lose all their hormones, the vaginal tissue changes. So when you have estrogen around, you have hormones around, the vaginal tissue is thick and it's moist and it stretches. And there's a lot of blood flowing to it and there's nerves flowing to it and sex feels good. And once you take away those hormones, that tissue gets very thin and very dry, and it might tear if you try to have penetration.
Yeah.
But there are things you can do. There's lubricants, moisturizers. If after you've had a thorough discussion of risks and benefits, you can choose to use low dose vaginal hormones, even if you've had breast cancer after a thorough discussion.
Because they don't go in your blood. Yeah. So
they don't. They do not raise the blood level of hormones. And I think a lot of women are really worried about that, or they heard that estrogen is terrible. You can never have estrogen again. But it's also a quality of life issue. I see 30-year-old breast cancer patients, and they can never have sex with their 30-year-old husband or partner. I mean, it can be life altering.
It can. And at True Women's Health, we're also going to offer the Mona Lisa touch, which has really good data. It's not better than estrogen, but it's as good as estrogen with
no hormones.
It showed really good effect. So it's not covered by insurance, but at True will offer that as an option. And I wanted to make sure we had the only laser that has good evidence and good data around it.
Right. And we have that capability too now to do laser. So it's really nice, really, really nice.
It's good to offer our patients.
It's
so
good
again, in terms of other professionals, so we have pelvic floor physical therapists.
I love that.
And Rapids, in terms of other professionals, if there's deeper issues in terms of history of trauma, there are trauma-informed therapists that can help in terms of how to reset. I had a patient who had terrible things happen to her when she was in college, and later on she had healed and been able to move through, had a good relationship, but then her friend's daughter had the same thing. It triggered everything and brought everything back. And so really it was important for her to find a good trauma-informed therapist. And, that PTSD kicked right back in, and it really was affecting her relationship.
Yeah. And the thing about pelvic floor physical therapy is if you're having pain from any other reason, if it's endometriosis or interstitial cystitis or vaginal dryness, your natural inclination is to tighten the muscles that surround the vagina. So they just go, and the vagina is just a long hollow tube with some muscles around it. And if you tighten them, it makes sex hurt even more. And so then you tighten them even more. And so that's where your pelvic floor physical therapist comes in. Who knew there was a physical therapist for the vagina, but they are excellent. I find that women sometimes are a little hesitant to go because they think, oh, that's weird. What are they going to do? A pelvic floor physical therapist. So on my YouTube channel, if you just search Dr. Becky Lynn on my YouTube, I have a couple videos on there about what to expect with pelvic floor physical therapy. Excellent. And I have 2 pelvic floor physical therapists that I talk to, and they just kind of explain what they do. And I think that's really good to just look at before you actually go to pelvic floor PT, so you know what to expect. And most women are so happy that they actually went, even when they thought, oh my gosh, nope, I'm not doing that. That's weird.
I just see a comment in the side from Laura, the Mona Lisa touch helped. It really is a great option. And so I'm so glad I can offer that.
Yeah. So I see a question about what is Mona Lisa.
Oh, please. Do you want to talk?
Sure. So Mona Lisa is a laser. It's a procedure that you can have done, and it kind of looks like an ultrasound probe. So, and it's, you just go into the office, the ultrasound probe goes in the vagina, and that laser beam breaks down old collagen and helps your body build new collagen, which is stretchier, healthier, more likely to produce lubrication. So the technology actually came from the laser of the face, right? When we try and look younger and all that. They were using laser on the face and it works the same way. And somebody got a crazy idea, let's try that in the vagina. And it looks like it works too.
Yeah, good. And it also stimulates new blood flow with little capillaries, little blood flow. So all those little mucus glands, which have died, they all turn back on again. So, it can really make a difference. And it consists of 3 treatments over the first year and then 1 treatment yearly thereafter. Hopefully someday the FDA will give clearance for it for the specific indication. Insurance will cover it. But at this point, unfortunately, insurance does not cover it. But we all do the best we can. So at least there are options out there, right? Mm-hmm. So any other professionals you want to talk about in terms of who are available to talk about sexual health? Maybe talk a bit about what does it mean to be a sexual counselor?
Sure. So this is something that I'm really glad I went through all the training to be a sexual counselor. So in my training, basically, we focus on more than just the physiologic. We can really focus on the psychologic to a certain extent. I don't take care of trauma patients. I'm not a psychologist, but I can really get down to the nitty gritty of the relationship and give people a lot of advice and homework and things to do in order to improve their sex lives overall. So I love that I can mesh the physiologic, since I'm an MD, with sort of the psychologic. And I think, like I said, you have to treat everything that is everything that's contributing for someone to really get to where they want to be. So I'm really glad that I did it. It opened my eyes to a world of options that I didn't learn as a physician. But if you don't have that, if you see a physician or a practitioner who isn't a sexual counselor, there are plenty of sex counselors, yeah. And if you go to the ASECT website, ASECT is AASECT, which stands for the American Association of Sexuality Educators, Counselors, and Therapists.
I can look it up the other day again.
Yes, you can find somebody near you, and that's another great organization who has a similar mission to us. We want to empower women to lead healthy sex lives.
I love that. Becky, also I want us to talk about HSDD. So,
sure.
The sex deck is the 27 reasons for low sex drive. But, I have patients that say none of those reasons apply.
Right.
Physically I'm good. Interpersonal, great relationship. And psychologically, I've not had trauma. I feel it pretty good. And I remember recently I had a patient in my office who just broke down in tears. And I said, it's called hypoactive sexual desire disorder.
Right.
HSDD, it's a fancy word for when that switch just turns. And we know that in some women, it's a biochemical, neurological thing. And now there's treatments.
Yeah. So that's actually the medical term, the hypoactive sexual desire disorder. And like you said, there's so many women who they can't find any reason. They just don't feel like having sex.
But they want to have sex.
They want to have sex. Yeah. What I hear women say is they want to want. We think that there's some things in your brain that sort of push you in the yes, I want to have sex. And then there are other things in your brain that push you in the no. And it's like a balance. And for some reason, in some women, it gets tipped towards the no, I don't feel like having sex. But there are some really good treatments for women with HSDD that are fantastic.
And they work, and there's good data, and they're FDA approved.
And they're FDA approved. So when they're FDA approved, they've been shown to work, and they've been shown to be safe. So there are 2 of them. One is called Addie, the other is called Vyleesi. And both of these drugs are FDA approved for premenopausal women with HSDD that isn't due to a not so nice partner or something like that. So Addie is
Can I interrupt real quick?
Yeah, go ahead.
So one tool that I use, I think you use the same thing, is called the DSDS. It's a 5 questionnaire that allows us to screen for people with HSDD. And so it's basically a series of 5 questions because, for example, if low desire is not a problem, then it's not a problem, right?
Right. Yeah, exactly. If you have low libido and you don't care you have low libido, you don't have to do anything about it. So I was going to say about Addyi. So it's a pill that you take every night. You take it at night because it makes you drowsy. The studies show that it works in about 50% of women, although in my clinic, I think it may work a little bit more than that. It takes 6 to 8 weeks to see an effect. But I'll tell you, the women who I put on it, it's not going to give you the sex drive of a 15-year-old boy. There's nothing out there that's going to do that. But it makes you a little bit more responsive, more spontaneous sexual thoughts throughout the day. And I really find that women like when they take Addyi. The other one is Vyleesi, which was just recently approved. And it's a little different from the Addyi.
We call it the horny shot.
Yeah, it's a horny shot. Yeah, kind of. So the Addyi you take every night. The Vyleesi you just take when you want to feel horny. So it's more like Viagra in that you take it when you need it, but it doesn't work anything like Viagra. So I don't mean to confuse anybody. But this is it's a little shot, but you never see a needle. It looks sort of like an EpiPen. You just put it in your thigh. And in about an hour, you'll notice that you're a little bit more amorous. So I think this is a great option for women who schedule sex because, like you talked about in Andrea and Dan, 11 o'clock at night when you're exhausted is never a good time. So couples really need to find that Saturday morning or Sunday afternoon or Wednesday night when they spend time together. So when you set that time aside or not, you can use it other times too. Then you can use the Vyleesi and sort of time it so you feel amorous when you want to feel amorous.
Yes, it works. And I like how you also mentioned, unfortunately, one of the side effects of Vyleesi is nausea.
Right.
And of course, that's not a real big turn on. So some women do find that if they take an anti-nausea pill with it, that it's worth it. And again, you might say, are you serious? I have to give myself a shot and take a nausea pill? Right. But, believe me, for women who get that switch turned off, this is just like a gift because they feel like themselves again.
Right.
And, researchers were like, I don't know if people are going to want to give themselves a shot. And, women wanted to give themselves a shot. So
it's worth it.
It's worth it.
That important to them. Right. And the other thing is the nausea gets better with time. And I just give people the Zofran. Every patient I've given Vyleesi to, I give a Zofran because the last thing I want is for them to be puking. That's just not going to work. And then they'll never try it again, even if I gave them a Zofran the second time around. So, I use Zofran.
Exactly. And so we've talked about some meds. Make sure I'm not forgetting anything.
Oh, we didn't talk about testosterone, though.
Oh, please. Yes.
Yeah. So testosterone, it's obviously a hormone, and it's that hormone of desire. It plays a big role in libido, but it's not the only thing that plays a role in libido. But women's testosterone, it's a little bit different than estrogen. It starts to go down in your late 20s, early 30s is when your testosterone kind of goes down. And that can definitely affect your sex drive. By the time you're in your 40s, late 40s, and menopausal after 50, it's very low. So they've done many studies. There's a lot of research looking at replacing testosterone, especially in postmenopausal women. And it's been shown to improve all things sexual. So it improves sex drive, it improves orgasm, it improves arousal. I mean, it works. Now, it's not FDA approved for women. Sorry. You were going to say, Diane?
I was just going to say, there's also data in terms of bone health and muscle mass. I mean, it's not the kind of hormone that gives you big muscles, but in terms of maintaining muscle mass, maintaining bone health, in men, it can be very important for sex drive, but also just like estrogen for women helps maintain bone, in men, testosterone is the main hormone. And so there's some effect that it can also have that effect for women.
Right. And help with fatigue. So, you if you think about the menopausal symptoms, when you go through menopause, you become tired all the time. You lose muscle mass. Maybe you don't feel like going to the gym, but that testosterone helps build muscle mass. Muscle burns more calories than fat. and it helps with fatigue. So right now, there is a consensus statement put together by the menopause experts of the world, the International Menopause Society, and their recommendation or their statement says you can use testosterone in women to improve sex drive. But they do recommend that when you
FDA approved.
Well, I wish it was FDA approved. But they want you to use FDA approved, yeah. So they recommend, you're right, FDA approved products. Even though they're products for men, you can sort of redose them. Women need 1/10 of the amount of testosterone as men do. And you can,
I love working with you, Becky.
I know. I think we trained with the same people.
I'm thinking.
Yeah, we do. I'm sure we practice very similarly.
Mm-hmm.
So you don't want to give a woman the testosterone level of a man. That's not where you want to go. That's not what's recommended.
Anger.
Yes. Acne, deepening the voice. Yep. Breast tissue atrophies. It's just, or the clitoris gets big. So, it's really important to stick with the FDA approved products for men.
So let me answer this question.
Yeah.
Hi, Abba, a good friend of mine. So we're going to talk about that. It's all about, so the guidance factor includes that we keep that total serum level less than 70. She's an internist, so she's asking that very good question. So it's all about keeping that systemic level less than 70. So the cool thing about using an FDA approved product is that we know it's consistent from dose to dose. Mm-hmm. And I use a product called Testim. It's a product for men. It's available generic. And I've talked to a couple local pharmacies in my area. The problem with Testim is that it comes in a pack of 30 little packs. And so a box of 30 packs, a guy would use 1 pack a day and rub it on his chest. And if a woman did that, again, bad. So for a woman, it's between 2 and 4 drops a day. Kind of depends on body mass and need, but it's about 4 drops a day. So I have talked to a couple local pharmacies, and they've agreed to break up this pack of 30, and they sell a packet for about $20. And they're all charging the same price, $20 cash. Your insurance won't cover it because it's not FDA approved for women, it's FDA approved for men. But at least it's not like the pellets, which I cannot
do. The pellets, very bad idea.
And I don't like compounded cream because you don't know, the people who make it are good people, they're well intended, but yet it's not FDA approved. You're not going to get that same consistency from batch to batch. So
let me say one thing about compounding. So there have been times where I've tried to get the Testim or the Androgel, and it's so expensive. My pharmacies will not parse it out, and insurance never covers it. So I do use compounded testosterone, the compounded cream. And because there can be variability from batch to batch and from pharmacy to pharmacy, I really try and minimize that variability with sticking with one compounding pharmacy that I use, and I follow their levels. I definitely follow their levels. And I have a compounding pharmacy who I very much trust. Mm-hmm. And I do use them because it's not expensive.
Exactly. And again, I do trust my local compounding pharmacy, but yet if I can give an FDA approved product, mm-hmm. then I would much rather. And at least luckily in this area, we can get Testim for just $20.
Good. Yeah.
Right. Mm-hmm. And so again, it's, 1/10 the dose. Right. And so it's, in the packet, it's the, we've been able to work out the dosage, and I have many patients using that and they do well. But again, some women don't need testosterone. So, and again, it's even more of an issue, I think, and even the data shows if someone has surgical menopause or instant menopause because of chemotherapy. Although for breast cancer, we're not comfortable using testosterone. Becky, I don't know how you feel about that, but it's, but if someone has a hysterectomy for really bad endometriosis, they lose their ovaries at 41. Yeah, you're really going to feel the effect of low T.
Yep, I absolutely see that all the time, especially with women who have the BRCA gene, the breast cancer gene. They have their babies and they have their ovaries removed, and they might be 35. And at 35, your ovaries are making a lot more testosterone than they are when you're 49. So when you take them out, that abrupt cessation of testosterone, women feel awful. And I feel like in general, we see a woman who's had her ovaries out. We're like, oh, she's 35. She needs estrogen. We give her estrogen. Right. But the ovaries make testosterone too. And now we just took away all of her testosterone. So it still boggles my mind that there's not an FDA approved testosterone for women, because that 35-year-old needs her testosterone.
I know.
Like you said, not just for sex, but for bone health and muscle mass. And she had it before. Why not replace it again? So hopefully in the future that will change.
Yeah. So Jill, I see you've got a question about, can you take testosterone if you had breast cancer? And my advice would be no, because unfortunately what can happen is that testosterone can get converted to estrogen in fat tissue. Even if you don't have a lot of fat, it can get converted to estrogen, and it makes us very uncomfortable that it could increase your risk of recurrence. So again, thank goodness we have other options in terms of treating pain, treating low desire, but I would not recommend testosterone. Becky, how do you feel about that?
I agree. I wouldn't give somebody with breast cancer testosterone, but I'm waiting for the day where it becomes possible, because I know there are studies looking at giving testosterone in women with breast cancer with a medicine called an aromatase inhibitor, which prevents the testosterone from getting converted to estrogen.
Exactly.
So there's not enough data for us to say, oh yeah, it's safe, so I don't go there, I don't do that. But I hope over the next 10 years that we get more data looking at the aromatase inhibitor plus testosterone, because they would benefit so much, breast cancer survivors, from using testosterone. So, and testosterone in and of itself, it hasn't been shown to cause breast tissue to proliferate.
Right.
It doesn't make the breast tissue more dense on mammograms. So there's a little bit of an stimulatory effect with this testosterone. But I think the concern is it gets converted to estrogen.
Exactly. And, I love sometimes what I'll tell my patients is like, I want you happy, but safety first. I mean, we took an oath, first do no harm.
Exactly.
And I think it's so important for patients to have informed consent. It's like we tell you what could happen, what's not going to happen, what are the pros, what are the cons, and then be your partner in what you choose. And if it doesn't work, then come back. We'll figure something else out.
And I do use Addy off-label in postmenopausal women. There are 2 studies that show that it works. And mechanicalisty, whatever the word is, it makes sense that it would work. So I do use it off-label.
It's just unfortunately the FDA made the researchers decide, are you going to study it in premenopause or are you going to study it in postmenopause? And the researchers thought it would affect more women in premenopause, so to get the FDA approval for that. But we know that it makes sense. And so again, I always document and inform people this is off the FDA label, but it makes sense, and my colleagues are doing it as well, and I feel confident, right?
Yeah. I mean, physicians use medicines off label all the time. And if you think about it, you're the drug company, you get it approved for premenopausal women. In order to go and get it approved for postmenopausal women, you have to spend millions and millions of dollars. So it's not worth it for a drug company to go after that indication. So it doesn't mean necessarily it's a bad idea. There might be a lot of data showing that, Addy works great in menopausal women, but the drug company's not going to try to get the FDA approval because financially it doesn't make sense.
Right. And again, that's why I really encourage women, if you can't see myself or Dr. Lynn, find a provider who knows the data. Like, it's okay to ask questions. I hate it when people follow advice maybe that isn't as informed, or they think, oh, just because they're a doctor or a nurse practitioner, they must know. Well, sometimes they haven't had that extra training. So I don't mean disrespect, but it's be an informed consumer, and ask those really good questions.
I think it is hard, though, with the internet for people who aren't in medicine, who don't have the background that we have to tease out what's true and what's not true. So that's why I think it is really important to stick with the big organizations like ISWISH and North American Menopause Society, or NAMS, because you're getting scientific, data-backed information.
Right, exactly. Another thing I like to talk about, with people, because it's like, what is sex, right? What is happiness in the bedroom? And I think it has to go back to it's pleasure, it's intimacy, it's that private time, that thing you do with your partner that you don't do with anybody else. And so it can help form emotional connection. And so, people will come in and say, we're not sexually active like we were when we were 20. Like, is that okay? I'm like, well, first of all, it's none of my business. But, it's like, you define what's okay. Let's
Right.
talk about what that is. So let's say a patient who's had anal cancer and radiation to where the vagina is just this long and this
Right.
it's just teeny, like penetration is not going to be possible anymore, right?
Mhm.
So it's like, she's like, I forget it. I lost it. It's done forever. I'm like, no, this is about, there's outer course and there's intercourse. So it's
Exactly.
intimacy and pleasure.
Right. It's not so sex is. I think what you're saying is sex is not just penetration.
Right.
And it's not always an end goal. Like sex has to happen like this, and I have to orgasm.
Or like in the movie, right? Like it doesn't have to happen in the movies.
So
like in the movie.
Yeah, that drives me a little bit crazy. If you look at sex in the movies, it's always a man and a woman making love. They both orgasm at the same time, roll off each other, and go to sleep. So for the listeners out there, when was the last time that happened to you, right? Like it usually doesn't work that way. And there are many women who can't orgasm from penetration alone. Most women, like 99% of women, can orgasm from clitoral stimulation. But the penetration alone, it's a myth. And so in my practice, I see women come in and they're like, what's wrong with me? I can't have an orgasm. And when I talk a little bit more, it's that they can't have an orgasm from penetration. And they're so relieved to know that
they're normal.
And the other thing I see is that the woman will come in and say, well, my partner, he thinks there's something wrong with him because he can't get me to reach orgasm from penetration alone. And so he's really relieved also that, nope, that's normal. And so, the clitoris is really the most sensitive sexual organ for a woman. It's not all about the vagina.
Exactly. So I think that's so good. So I can't believe how fast that we can talk about this. So what I want to do is bring us to the 5 tips to bring happiness back into the bedroom. I think it's always good to have a list. So first of all, if you want the sex deck, it's available on our website. Again, if Dr. Lynn would like some, we'll send some down. But I think tip number 1, when people have heard me talk before, I think everything starts with having a clear intention. We have to have a goal, right? So it's to have an intention about what you want. So sometimes I'll ask people like, what is hard for you? What is really difficult about your sexual life? And then let's turn it around to a positive. So what's hard for you is you have pain and you feel like there's something wrong with you. Let's turn it around and say, I don't want to have pain with sex. And so let's make that a clear goal. And then let's knock it out of the park. Let's figure it out, right? Becky?
Right. Yeah. So I just thought of this, and I just want to put this one thing here, talking about pain and not being able to have penetration, like someone who's had radiation in the vagina, like the O nuts. There is like OHNUT. We're
going to sell them at True.
Are you? I need to set myself up to do that because I already have so many people who love them. They're like
Jail's number.
Yeah, I'll take it. There are these little rings that go on a man's penis, like right here, and they prevent him from going too deep.
And they're soft and silicone, not hard.
Yeah, it's not a ring like a metal. It's a soft. It's kind of like the same consistency as the masturbation sleeve, and it helps the man feel like he's in deeper, yet the woman is not in excruciating pain. So I just had to throw that in there.
No, I appreciate that. And I guess the other thing that I'll bring up is also what we're going to carry at True is something called Millie. So patients who have seen me before know all about Millie because we have Millie in the office. But Millie is a dilator that starts small and gradually goes larger. So if someone's had radiation or surgery or endometriosis or
no sex in a long time.
Exactly. Well, like the 80-year-old who I talked about, who met George at the trailer park in Florida. And so, she got Millie, she got some vaginal estrogen, she was good to go after a little while. So it's really important, again, to have that clear intention and know that there are providers that know lots of things like the ONUT, like Millie, like vaginal estrogen, kind of get everything going on again. Hello from Australia. That's awesome. Number 2 is get rid of shame about lack of happiness in the bedroom. Shame. Don't have shame. I'll tell people, get rid of shame. Don't feel bad about this. You're in a safe space. Everything we talk at True is certainly HIPAA protected, does not leave the exam room. And, we use, for example, too, an electronic medical record. Sometimes I'll tell patients, tell me what you don't want me to put in your chart because you or your partner could read it afterwards. So get rid of shame.
Right. I absolutely agree. I mean, I think we have such a double standard in our culture, and we have to work to change that. Definitely.
Good. I love it. Tip number 3, consider the reasons why you don't have happiness in your bedroom or why you don't have issues. So again, one tool is the sex deck. Again, I just invented it as a way to make it easier to talk about it. But there's tools, Dr. Lynn has a chart she has in her office. Ishwish has articles. Dr. Lynn has YouTube about it. I've got talks about it. And we have lots of colleagues across the country. Heather Howard is a PhD who started a site called Ergo Erotics. So for people with really bad back pain, or bad back pain or physical limitation, she's made special pillows and such. You can check out her stuff, ergoerotics.com. So, and we'll put that in the comments later. But figure out the reasons and then let's talk about it.
Right. Totally agree.
Tip number 4, prioritize self-care. So at True, we talk a lot about the seeds or the 7 essential elements of daily success. We'll post the link to the article about seeds and all that. But it's about self-care, and the seeds is the checklist of the seven areas of self-care. But for example, we know women who exercise, who lift weights, especially women who do yoga and practice being in the present moment, have a better sex drive. They're more likely to not be distracted. Right? Back to self-care is so important.
Right. And yoga helps with pelvic floor muscle spasm as well. Yoga is the best, the greatest thing.
Hip openers and
it helps, oh my gosh, it helps for anxiety by just the breathing exercises. It strengthens your core. It improves your balance, which becomes important as you age. And it relaxes the pelvic floor. So it's just the greatest thing since life.
But in seeds too, we talk about drinking your water. If you don't drink your water, you can have all the estrogen in the world and you're still going to be dry as a desert.
That's a good point.
Drink your water. If you're eating way too much sugar, you're going to be tired and lazy and fatigued and overweight and feel ucky and not want to do anything, let alone have sex. So you've got to do self-care. Get off the sugar, exercise, and drink your water, and prioritize sleep. Like Andrea, the patient we talked about, she's not sleeping. She's staying up late doing work. She's getting up early to get stuff ready before she leaves for work. You've got to sleep or you're not going to have energy for anything.
Right. Let me add just one thing at Evora that we've taken on, which I'm so excited about, is helping women lose weight. We have a nutritionist that we work with. She's specially certified in obesity. I don't like that word. But so at Evora, because it's so common in menopausal women, we're now including that in what we address, because so many menopausal women, they get to the 50s and they just gain weight around their middle and they're not exercising, they're not doing yoga. So I'm really excited about what we have to offer.
I love that. And at True, we have the same thing. We've hired Anna, Chef Anna. She's a CIA trained chef and a nutritionist. Ooh. And we have a kitchen in True, so we're planning on doing not only classes, but also women can have a consult with Anna with menu planning. And down the road, Anna and I are writing a cookbook called Doc in the Kitchen. So very excited about that. But again, it's having those choices, and we women need complex carbs for energy. But menopause makes us insulin resistant. So we just last week I did a Facebook Live on belly fat and chin hair. Unfortunately go together, but so it's all about that insulin resistance.
Yeah.
Good for you.
Overcome that. And exercise helps a lot to overcome insulin resistance. So.
Yes, it does. And tip number 5, speak up for what works for you and what you want. So many women are so shy to go home and talk about a vibrator. They're so shy to talk about what they want. And it's just sometimes saying that word, starting that conversation, $10 your partner's thinking about it already. They're shy to bring it up. Right. And maybe even start the conversation by, I want to talk about something that I'm a little nervous to talk about because I'm afraid you'll think, whatever. But just kind of starting the conversation that way. And, it's almost like people see this instant relief, but you've got to ask for what you want.
So one little tip that I do to help couples broach the subject when it's so difficult is I have them, part of the homework that I send them home with, is I have them go home and define love, sex, and marriage, They define those apart, and then they come together and talk about it.
That's awesome.
Yeah, I love it. And it's just a way to bring up the subject without being like, oh, I don't like it when you do this, or without offending your partner or having it spiral into something bad. So I love sex and marriage, and it seems to work.
That's good, because we don't want people fighting about this, and then it's a bigger issue.
We don't want feelings hurt either, and feelings can get hurt. So.
And people take, of course, sex is so personal, and people take this so personal, and really want to make each other feel good. So it's that's an awesome tip. So those are the 5 tips, and we really recommend that you really give a deep think about what you want, speak up for what you want, find someone to help. Don't be ashamed of asking these questions. And again, if you, share this, if you watch this later, put a question in the chat bar, and both Dr. Lynn and I will see them, and we'll make sure that we answer questions. You can find Dr. Lynn in St. Louis. Her website is up on the screen right now, but she's taking new patients. And now, right, Becky, are you seeing people by telehealth?
I'm doing both, actually. So we are seeing patients in the office, but if we just need to talk, then we do it by telehealth. So we're going in the office if you need an exam, if you have sort of an emergency or something going on. But other than that, we're doing a lot of telehealth, and it seems to be working great.
Oh, I love it. Yeah. And so at True, we now have a new app actually called True Women, our app, and we're able to do telehealth right in the app. And our patients can text us on the app. I've had how many patients text me today with, hey, that medicine, maybe I need more, or I've got a bladder infection. And so we're also doing telehealth. And then construction started back up again. So we will open our doors for patients. We have patients scheduled in the office on June 15th. So very excited.
So one little thing I do want to say also is to anybody who's out there listening, if I've seen you before, please share the Facebook Live, because I think it's really important to let women know that we're out there, we're doing this. So please share it with your friends, and hopefully more women can benefit from what we've talked about tonight.
Sounds good. Yeah. And we're streaming this to our Facebook as well as to YouTube. So there's a True Women's Health YouTube channel, Dr. Becky Lynn's YouTube channel. So again, feel free to share and, let us know future topics. So Becky, I can't thank you enough for joining me tonight. I would love to think we will do this again, and look forward to working with you together in the future. So thank you so much. I wish you well in St. Louis.
Oh, we have one question. If you share it, no, it will not share your comments.
Oh, perfect.
Right? Don't share the video.
It will not. And also,
or your names. Your names won't be up there. Yes.
Sorry. And people also have asked me if I'm watching it, will my friends know I'm watching it? This is a little bit of a sensitive topic, and maybe you don't want your friends to know that you don't have happiness in the bedroom. And so, if you watch this at a later time, then no one will know that you're watching. If your friends are on live with you, they might be able to tell on Facebook, but they won't know after the fact. So you can share it with friends knowing that they won't be seen. And Dr. Simon, thank you so much for that comment. You're amazing. Thank you, Jim. And I can't wait to see you next week, Dr. Simon, on our joint Facebook Live on HRT, It's Safer Than You Think.
And I will be tuning into that for sure.
What's that, Becky?
I will be tuning into that for sure.
Awesome. Very good. So again, we're signing off. Thank you so much from True Women's Health and the Evora Center for Menopause and Sexual Health. Take care, everyone. Stay safe.
Bye-bye.